Welcome to Steady Balance on Spotify, your space to understand the science behind balance and vertigo.
Hello, this is Dr. Debayan Tarafdar. I'm an ENT and head neck surgeon working in Kolkata, associated with Manipal Hospital Broadway, Manipal Hospital Salt Lake, Visan Hospital. If you have ever had vertigo and ongoing dizziness, you will know the symptoms are only the part of it. The other part is knowing which doctor to show. Some patients will start with one doctor, then get referred to another doctor, then another one. Meanwhile, the dizziness continues, the life gets harder, and the whole experience becomes very, very frustrating. So today, let us make it very simple. Today, we are going to discuss on this topic of which doctor to show when you are having dizziness. First of all, for most people, the first step will be a general practitioner or GP. A GP can take full history, review medication, check for general medical causes like anemia or sugar problems, and do some bedside assessment to narrow down exactly what kind of dizziness you are facing. If the dizziness is brief, triggered by turning your head in the bed, looking up, or changing your head position, it can indicate the commonest type of dizziness that is called BPPV or benign paroxysmal positional vertigo. A GP can successfully diagnose a BPPV by doing Dix-Hallpike test, which is a simple bedside test to to ascertain whether you have a BPPV or not. Mostly, this BPPV is managed with a simple physiotherapy, which is called Epley's maneuver, which can be also done by some trained GP. Now, next comes the most important inner ear problems. And for that, you have to visit an ENT specialist. ENT stands for ear, nose, and throat. And we, ENT specialists, we are seeing the most number of vertigo patients because if we go for statistics, almost 80% to 85% vertigo is happening because of ear-related issues. If your dizziness is accompanied with ringing sound in the ear, or hearing loss, or ear fullness, or you are having repeated vertigo attacks with head movement, that might indicate a ear related problem or inner ear related problem rather. So you have to go to an ENT to get yourself assessed properly. An ENT specialist will write you down some vestibular specific testing which can diagnose and pinpoint the exact cause of your vertigo. There are many inner ear causes that can cause vertigo, like Meniere's disease, vestibular neuritis, and others. These diseases can only be successfully diagnosed by an ENT specialist. Next comes the neurology. Now, there are many cases of dizziness which is directly related to neurology. A common example is vestibular migraine. Now, in common man's perspective, migraine means headache, but it is not always so. In vestibular migraine, similar to headaches, dizziness spell can come alongside visual changes and other symptoms of migraines like nausea and all. This can be indicative of vestibular migraine, and for this, you should visit a neurologist. There are other kinds of vertigo which can be associated with our brain, but proper neurological examination is essential if you are facing vertigo alongside other neurological components like blurring of vision, like limb weaknesses, slurring of speech, all those things. So if you are having all those symptoms, please visit a neurologist. Another very important thing for assessing vertigo is vestibular test, which is done by a vestibular audiologist. So these are clinical diagnosticians to whom we refer the patient for proper vestibular function tests. There are many vestibular function tests that we order for patients, like video nystagmography or VNG, head impulse testing, vestibular evoked myogenic potential or VEMP, electronystagmography or ENG, and so on. This can pinpoint the exact cause of vertigo so that it will help us to diagnose and treat you patients better. Another very important part of vertigo management is vestibular physiotherapist. Now, vestibular physiotherapist can train you with different type of exercises which can rehabilitate your vestibular system. So all these specialities are important, and this particular knowledge is important for a general patient to understand whom to seek help from if I am facing dizziness. Lastly, as a doctor, I know dizziness is a very frustrating symptom by itself, but more frustrating is the uncertainty associated with it. Whether I will be treated properly, whether I will get cured ever. So, hopefully, this particular episode will give you a general idea to whom you should visit if you are facing giddiness. Thank you for listening to me, and hopefully, these words has helped you or will help you in the future. Thank you.
A public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.